Emergency Medical Services Commission. Today is Tuesday, April 29th. Time now is 5 p.m. Could we begin with the Pledge of Allegiance, please? Pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all. Obviously, we're all underdressed tonight, too.
Yeah.
I said, obviously, we're all underdressed tonight. You look
I
great.
have 3 other meetings.
I know.
I got it.
I know. We'll move right along.
Okay.
So we'll begin with public comments. We do have some public here tonight. If you have any comments or like to say something, please rise, state your name and your address, and we'll hear you. No?
I think it'd be appropriate if I would like to ask my fellow officers that help about their fire department service, our EMS committee to introduce themselves. That'd be appropriate for.
To the EMS committee to introduce it or to them to introduce
For
it?
them to introduce themselves to you and the rest of the meeting.
Sure.
Rest of the commission. All right, Dave, you want to start? with-
Yeah, Dave Wood, EMT, and I'm trustee on the board of directors.
I'm William Mokovic, elected president beginning this year. So, if you have any questions, feel free to-
New president. Gotcha.
Who's our president?
That's how you know I'm president. I softly.
Carry a big stick.
Yeah, there you go.
I'm Stephen Quirk, I'm the EMS captain. I believe.
Heather Lloyd, treasurer. Gail Clark, I'm a former EMS captain and I'm currently the EMS director.
Virginia Yako, EMT and secretary.
Pleasure. Well, I appreciate the invite. I appreciate you coming, actually. You know, it's not, we're not gonna have a ton of business to do tonight, but it's fantastic. If you want to turn out somewhat regularly. We only do this quarterly. Would love to have you as a regular part of this. Cool. Do we have any correspondence?
No.
Okay. We have minutes here from the special meeting of January 28th. Do I have a motion to approve the meetings from the 28th of January 2025?
I'll make a motion.
I'll second it.
Okay. Any discussion? And let's see, was anybody not here? Looks like we're all here. Okay, with that, I'll try minds. All in favor, say yes. Yes? Aye. Motion passes. Okay. Next up, we've been having ongoing discussion about how the town provides emergency medical services and a possible agreement with town agencies. For you having not been here, I'll just kind of give you some background on this. This started in the summer of 2023 when we were approached by Nuvance, and they increased our paramedic costs to the town, somewhere in the neighborhood of $120,000 a year. And we started seeing at that time, it was probably, we should all be working together from the two departments in the town side to do what we can, whether we wanted to do a common letter of agreement or something where we're using the same companies. Because I know we use two different companies in the departments. You guys are all Bethel though, right? No, Stony Hill. Yeah, because Stony Hill uses one, you guys use another. We use different billing companies, and we have a third paramedic company. So the question is there a way we can do synergies? Where we stand now, we've had conversations about doing an RFP to see if one company could come along and then do it, maintaining our 3 separate licenses as well. I know at the beginning we talked to some even about doing a common ambulance association. Doesn't look like anybody had any appetite to go that direction, because we wanted to keep the EMS in the departments. That was kind of the big thing. But we're trying to look for some way to do something together where we can save money, have common synergies. That's where we've left it. We haven't really moved forward with the RFPs. I think there's a lot going on. And I can ask for a report from Tom. I mean, are we anywhere on getting?
No, right. I'd given a sample to Rick Johnson, but I think he was kind of taken off. Did you talk to Rick at all, Doug?
I have not. Oh,
Briefly, but not about that. Just that what we discussed was trying to get, we're working towards the same billing agency, and we're currently in the process of looking at going with the same staffing company to try to be all on the same.
see if we can get a better deal.
Yeah, it's literally in the works.
Okay, well, that's perfect. So that's being led by the EMS.
By the
in
EMS
both
captain,
departments?
yes.
Okay.
Well, we haven't contacted Bethel. We're just contacting Bethel vendor that they use.
The Bethel vendor. Okay.
Yeah.
Now, I screwed this. Oh, you guys Vintech?
Yes.
Okay. Gotcha. Because I never know. And yours was
EMR.
EMR?
Yeah.
Okay. You have a question, Chief?
Yeah, I do. So you just indicated that you're probably going to go back to EMR.
We don't know. We're getting prices, we're getting quotes on different vendors now, right? To see what the market is out there for.
Yeah,
Have you guys alluded to them that maybe you guys could do something together and maybe get a?
That hasn't been discussed,
Okay.
but we should sit down and discuss that.
I don't mind saying it here in public, but, I know the gentleman who runs it, who's a really, really nice guy, he's quite ill at this time. And, I don't know what that would do to, that agency in the near future.
So your feeling is if him being out of the loop right now, it may not be as strong as it is normally. That's the EMR or the Ventec?
EMR, yeah,
Okay.
really nice guy, but the last 3 or 4 days,
Yeah.
multiple people said, you know, he's just not doing so hot, so.
Right.
Too bad, good guy.
Tom was mentioning that you had, who was working again?
So Rick Johnson,
Rick Johnson.
EMS captain.
Okay.
So I took the last paramedic RFP, right, for the paramedic program, the last request for proposals. And kind of omitted the paramedic part and gave it to Rick to kind of see if he could write up, because he offered to write up kind of an RFP for a combined billing and staffing for both departments, kind of see what that costed, right? Is there a savings somehow if we use the same billing company and the same staffing company total? We have to look at that number and say, okay, well, you know, it's X amount of dollars less than what both companies are paying now. So it's a cost savings that way, at least, right? So he started to work on that. I think he kind of got pushed off of it. What I understand. So it's something we just, you know.
I mean, would you know, I don't know, can you get?
But the
back on
commission
it?
has, I
I
think,
have to
the
read
authority
this.
to, you know, put out RFPs for things like this. So it doesn't have to necessarily have to go through. I don't think each fire company do it. We can put it out there just to see what numbers are.
It doesn't matter getting it written.
I would have a question on that
Yeah.
through the chairman to Tom. Do you know what you're paying right now for, that service, the billing service?
No idea.
We had it, we talked about it last year before last. We had all the
Well,
numbers.
Yeah, the billing service is based on
Yeah,
what you collect, right? It's a percentage of what you collect.
There's a percentage charge for the service.
And this commission has the authority to ask both fire companies for their finances. So it's something we probably at some point should do if we get an RFP to see where we're at with it.
we had the finances 2 years, like, well, I'll say 2 years ago now, technically, it's
Yeah,
43.
They've got more.
And then we just haven't moved on it since then. And I know we're gonna get another hit this summer with, New Vans. Well, they're gonna be Northwell by the time they bill us. Yeah,
And that could be maybe a bargaining chip too. If it becomes Northwell, maybe there's an opportunity there to renegotiate with them for the paramedic portion, right? I don't know. Who knows what their model's gonna be and what they're gonna provide, right, for EMS?
and right now, I think we've just kind of come to the point where if we can do something somewhat together, it would be smart to save the money for all of us, because we're getting, I mean, I don't want to necessarily do what Brookfield does. We've talked about that, where they have their whole big EMS thing, and it's pretty top heavy on people. It's very expensive. I'd like to figure out a way we can do it that's just actually works for everybody, because we're never, town's never going to make money on everything, but the truth is we're eating a big chunk of it.
We talked about doing
Yeah.
1099 and the EMTs in the firehouse
Mhm.
and just having them staff the ambulance during the day. But it's all, legal and what can we do, being a nonprofit and all that. So that was something that me and Rick discussed. But we have to continue that conversation.
Can they do that? Just do 1099 EMTs? Because I don't know how that works.
I think so.
We're not, if we're doing the schedule, it might be tricky. Let's look into it.
Yeah, it's on there. It's on the.
I'm open to anything. Like I said, from the town's perspective though, we're getting eaten alive with the paramedic costs.
Well, I think that's
So I
something that
think-
the town has to, we have to do something with the town with the paramedic program.
Well, the only thing we can do is something together, because right now it's a set alone program, right?
There is no other paramedic programs out of like Norwalk or.
Very, very few that give us everything we get from Northwell. But
Could I,
go ahead.
can I offer?
Yeah, of course.
comments? So a couple things that you guys have talked about, the rate that
Mhm.
we currently pay with Ventec. Ventec has said that, if we were a combined agency, that there would be savings there. In the rate between the two, it would be, I'll say easy is what he said, easier to have both agencies in town and be able to staff them. And then also he does have paramedics, so he could offer a solution as far as that's concerned as well. What was the other topic? The billing. So our billing company, I do know that Rick did talk to Sandy at Shared Response. And it's 8% is what we currently pay for the billing services that they offer us. And they bill the ALS and BLS service and everything.
Right.
Just like,
Well, there's been some, I say questions among the commission, if your billing company is as good as, or is better than the one Stony Hill uses or vice versa.
Well, the one that
Because we've
they're
had-
using is the one that we want to go to. It's
Okay.
better.
It's the better. That's what I thought.
I think the billing service, it does rely on completed charts, and there's a lot of things on the front end that
Right.
allow for successful billing. So.
Yeah.
I know.
Well, it sounds like the departments have been working pretty closely to standardized charting, right?
Yes, we switched it. We're all on the same charting program now and everything.
Right. Okay. Well, there's always improvements to be made there.
Yeah.
Right. But I think integrating everybody makes a lot of sense because it's kind of like Ben Franklin said, right? If we don't hang together, we're going to hang separately.
I think what we need to do is just sit down with Bethel
Yeah. Okay.
and have a joint meeting between Bethel and Stony Hill EMS and
Great.
present something to this committee that might be able to take the paramedic program and roll it all into one.
And I think what we end up doing is doing it by probably a memorandum of agreement of some kind, because we still have the 3 PSAs to deal with.
I don't know how that
Yeah.
works with the PSAs, if that would have to go to one of the departments, with
Yeah.
the paramedic program or not. Do you know anything about that, Tommy?
It all depends on what you want to do.
Listen, I know historically,
Options.
historically, I know there was a little bit of, I'd say pushback from going to one department over the other with the PSA for the paramedics.
I don't see an issue using
Yeah.
the same service, so for,
No, but the technically PSA license is under the PD. I think I think it made it was competitive, I guess. I don't know how the departments are now about working together and having on one or the other. I'm open to doing anything I can to save money
no, I think
Right,
we're in a
and-
better direction
yeah.
now than we were.
and still deliver the quality.
Yeah,
Right? I don't,
Quality
we have,
comes before anything, right?
yeah, we have great quality. I think the only thing we talked about, and again, this was before your chief, we talked about whether or not we should be running ALS buses. Like
And
one or
that
two.
was- And that was
Right.
already brought up from Rick and
Resident-
that's actually a cost saving right there, just running
Yeah.
ALS bus, but depending on where you're gonna put it and what times of the day that you're gonna use it. You know,
Sure.
you're gonna have it. It all comes down to the busiest portions of the day.
Mhm.
You know, you're not gonna want an ALS bus all night long and for,
But you have to.
yeah, you have.
You have an ALS service, you have to.
You have
provide
to,
ALS
yeah,
service.
there's no-
You have to have at least one, correct?
Mhm.
So one could be BLS at Stony Hill, one
Yeah.
could be
And
ALS.
ALS, it has to be ALS with the ambulance, right? Not just fly car.
Well, yeah, if you do the ALS transport version, yeah.
Yeah, because then you'd have to have ALS transport all the time.
Well,
So
you
it's-
could do,
we're
you
open
could do
to-
one ALS ambulance and one backup medic, just the way that we have now.
Sure, we could, as long as we always have one.
Yeah, as long
We
as
could.
there's always one.
Right. Yeah, and there's questions too about quality of care, that with an ALS bus, sometimes there's a better quality of care. Sometimes they can bill for other things too, because there's been a lot of talk about better quality outcomes on ALS bus too. So,
And our issue
I'm
though,
open.
during a certain time period, you're getting multiple ALS calls on either side of town. You
Yep.
know, we could be at Bethel Healthcare and have another ALS call down here.
Yeah.
Or 2 ALS calls down here. I
Yeah.
think the other day, I think we had 4 paramedics that got.
Yeah.
From out, they came in from,
sure.
it was a busy day.
So to your point, when you guys get together, if you guys come up with what the plan should be.
I'll talk to Rick and get a hold of Bethel and we'll set up
Okay.
a meeting and try to,
Great.
well, I think we should bring Tech in and I don't know how much you want to, steer towards talking with Ambry Hospital right now with everything they got going on. But there's other vendors out there that offer.
Yeah. I mean, I think we should always keep them in the mix. That's why we're talking about doing RFP. Right? Because we put it out there, then they can tell us what they can do. Like, once you guys come up with what you want, then let's go put out an RFP
Yeah.
and look at these
Yeah.
companies and see who's going to give us the best. Because remember, there's a lot of things that the Ambry does give us. give the training for the paramedics and they give training for the compass and they do all these other things too. So I'd like to see soup to nuts if that's possible, what we can get from them.
I'll set up a meeting with Bethel.
Okay, thank you.
Just like
Yes.
a comment on, going to a second paramedic, maybe having a full paramedic car and a black car backup or whatever, that's a considerable cost.
Mhm.
Newtown is switching to that right now. I assume it's gonna start the first fiscal year, and it's a considerable expense. I think you'd have to look and see, you know, where that would take us financially. But I would like to make just a general statement before we go any further, is that the Bethel Volunteer Fire Department, in terms of their EMS operation, is very, very stable right now. And that's both operationally and financially. And we look to be that way, and we will be that way for the foreseeable future. So we're in good shape. Okay. So whatever direction I think the committee here from the firehouse wants to go, we're starting from a good position. All right. And I think that the other aspects of it, the buildings and things like that, I think we can work together on that too. But you know, right now between the two of us, you know, about 3,000 calls a year, and that's a big nut to crack. And so far we're hanging in there. So let's see where all that, you know, what direction that goes in. But you know, whatever direction it is, we're in good shape. Okay.
Yeah.
And we will be for quite a while. I feel very confident to say that. And I think that the support of the people here as well. So, you know, wherever we go, but we're going in the right direction.
Yeah, well, I appreciate that. And I know you guys are doing a fantastic job. And we're definitely looking at the cost of this because that's a primary driver. You know, we will look at it inside and out because that's kind of the purpose, but we don't want to sacrifice quality of what we've got. So you guys understand that we're not looking to upset the apple cart just because we've been talking about this for 2 years. And it's very real to the taxpayers in town. And, you know, like I said, quality of care is pretty good. ALS bus service is good, great quality. And, you know, we use less EMTs at the time, right? And we get more billing back in some cases. So it may break even. But this will be you guys are going to have to really look at it and let us know what you need. If we need to get a consultant to look at this, we can do that as well. Like if we need help, because it's serious, right? We're getting into a place where very, very expensive. And
Sorry, and that's just the call volume's picking up.
Yep.
We're $8,000
All of
we're
it.
down on calls this year,
Yeah.
so right now, but summer's right around the corner. You know,
Yeah.
It's gonna,
well, there's also been the issue with kind of the demographics of town, right? You know, Stony Hill, you got 25% of the district, but you're making a ton of calls and you're doing it out to to Bethel Healthcare
Yeah.
a lot of the time. And sometimes it's harder to bill. You know, it's harder to get reimbursement.
yeah, I think we had 242 billable calls. We had 88 calls that we couldn't even bill for.
And that's a challenge.
Yeah, there's a lot of you know, the nursing homes, right? But we're making them.
Outstanding.
Third of the billing loss is significant stuff. That's across the board. I have a question for you, Mr. Chairman. You mentioned the possibility of looking at other services being provided by the ALS providers here in terms of possibly generating more income. Did you have anything specific you were?
My understanding is that as an ALS bus, they can actually do is a question of review of the patient. They can actually do
Assessment.
assessments. Trying to think of the word, couldn't get it out. They can do an assessment, which actually they can bill for an ALS bus. Now, I'm not looking to add on, you know, bills or anything like that, but the question has come up, and again, I'm not the expert, you guys are. That when you have an ALS bus, they can do an assessment.
An assessment and
Yeah.
no transport, downgrade, yes, that was billable. All right.
Yeah.
There's other things which we've discussed too about these constant lift assists. You know, they're significant,
Well,
and
Yeah.
maybe we should look at that as well. But
You
again,
can bill
it's-
for those. BLS can bill for those
We
as
can
long as
bill,
you
right.
provide a treatment,
But
correct?
what
Yes.
we look at, Tom, and we discussed this, is that it appears that most of those people are not in a financial position to pay for it because they don't have a family member or a caregiver that can help them. So basically they're calling the fire department all the time. But there are times when it gets pretty significant. And I think we should look at somehow how to address that.
Can departments, can a volunteer fire department run a minivan service? No?
No,
No, I'm just asking. It's,
Still have
it
to
came
step-
up recently with somebody like in Shelton or something, that they've been able to pawn off some of these extra calls to like a minivan service and getting people transported regularly.
You'd still have to.
Well, this
staff
would
that
be,
with
uh,
EMT or
yeah.
something.
I'm just asking.
lift assist with no transporters, what I was referring to, I'm sorry. But sometimes you get there and they have to be transported, there's a medical condition.
Sure.
But most times it's not. It's a big
Yeah.
burden on the services.
I know, I hear it on the radio all day
Yeah,
long.
right.
Well, we're open. So maybe at the next meeting, we can come back and you think in the next quarter, you guys can have that meeting and start
Yeah, we
moving
could-
forward.
we could set something up.
Be great. And like, listen, with our next contract with Movance, Northwell, I'll try to do what I can to keep our price down and give us some options. I mean, they've been very willing to work with us as much as possible. So,
They, there's significant stories in the paper about the cost of operating under that Northwell umbrella. And of course, they reference regularly the higher costs.
it is one of the most expensive healthcare systems,
Right.
they said.
But what is the second largest or the first largest in the United States? It's first largest and Trinity's the second largest.
Yeah.
Yeah.
Also, we'll see how that goes with what they charge.
Right.
The only thing that I think we have going for us is they've got a reputation of really trying to bolster their local hospitals. Like they don't have, they have a lot of flagships, they call them, but it's not like, if they had joined Columbia, now we would have to send a lot of the most important cases to Columbia instead of Denver Hospital. And that kind of degrades their program to some degree. That's not going to happen from what I understand. So hopefully it's a good system, you know? So any other discussion on that? I mean, I think we're leaving it that you're going to meet, get Rick back involved and,
Yes.
let us know what you need from the town's perspective, because if we do need some sort of study or something, but I'd love if we could move along and just find some common ground to save a few bucks, but not sacrifice care. Awesome. Thank you.
So the only thing I'm gonna
Go ahead.
add is.
Yeah.
So we are required to have an EMS plan. I brought this up, I think, at the last meeting, right? We have an EMS plan that's supposed to be adopted by the EMS commission from the state OEMS. It's a cookie cutter plan, but one of the key components is the contract in there from each ambulance service. It's a boilerplate contract about providing services that's been signed in the past by both fire companies. So I sent it in January to the presidents and the EMS captains of each firehouse, and we haven't gotten it back yet. So we
Did
gotta
Melanie
work on,
look at that one after, before you sent it? Or is that
I
the one
don't
that
know.
She was sitting on.
maybe one of the
Okay.
ones she has, but
All
we
right.
gotta work on getting that because it was due in February.
Okay.
And
Well,
Yep.
you said it was due in February?
Yeah.
Yeah.
All right, I would like to defer through the chairman again.
Yeah.
To the representatives here and ask them if they would like to discuss that. You comfortable with that?
I mean, I can say as the president,
I don't know if you-
I haven't received it.
okay,
Yeah.
I think I sent it to Devin and maybe, I don't know.
I do know-
It was kind of in between. I don't know if it was before or after your election, so. But
So
I
we
think
did
Devin and
review
Jess.
it. There were a
Yeah.
couple of clerical errors, for example, where the name of the organization is not correct.
Okay.
Dave had some other comments, or maybe Devin had other comments.
We just had two little changes. I've had it.
Okay.
We can get it sent over and talk to them.
Yeah, no, that's fine. Just,
I don't think the material.
just wanted to follow up that, get that done and.
But we can have that.
Because the overall plan is just, grammatical changes, the name of the selectmen and things like that. There's some metrics in there they want us, there's things that they want us to kind of look at doing forward, like one of them is creating mutual aid, which is on our topic. So they just want to have a couple of things in there to say that we're looking forward to doing and, goals to achieve. So, but the big part is getting this from both fire companies, the signature on the
We'll be
contract.
reviewing it.
Okay.
I have to get a vote from the company.
So you have, all right, so you got it, okay.
Okay.
And I'll just make sure Melanie has it. I'm probably,
Because that would,
Double
she
check.
should have, that should be the newer version.
yeah.
Because she had HIPAA questions, all kinds of stuff. So that should be the newer version.
Who
Can you
needs-
check with Tony House?
With Melanie O'Brien, the town attorney.
No, I mean, who should we send to the attorney or
Send
send
him.
to Tom and then? okay.
Such a Tom.
Yeah, if you have changes, literally like cross them out and write them in or whatever, and then we can get it changed, you know?
Yeah, we'll do
Send it
that
back.
by the end of the week.
All right.
There's been significant work by these people on that contract.
Yeah.
All good.
All right.
Okay.
So next up, discussion of the Bethel municipal aid agreements. That's you, Tom?
I
Oh, do we
guess
have, do we have any right now?
no, I mean, again,
Yeah.
same thing. I know Melanie had a couple agreements. One was with Newtown. Like I said, we probably should just have the same agreements for both fire companies for providing mutual aid for EMS for outside agencies, right? I mean, this should be, have a matrix with our dispatch center about
Yeah.
when we go and when we can't go.
I'll check with council and see where that is.
Yeah.
If they were done, because I know they were working on them at the same time.
It should-
Okay. Great.
And I think, you know, Chuck has his opinion on it, but I think it's not an agreement necessarily that the town of Bethel signs off on, because it's the two EMS agencies,
Yeah.
the nonprofits, providing an EMS service to other towns. They should kind of be the ones that say what they're gonna do, right? Where they're gonna go and who they're gonna provide services to.
Yeah.
And generally, we provide it to anybody that calls. We're gonna, right, the EMS agency is gonna go, but at least having some formal written agreements for providing ambulances.
Yeah.
You know, do you say if it's just for a BLS lift assist, you know, do you say we're not gonna provide that in a certain town or something? Because there's a large volume of them, you know, do we want to do something like that? Or you just go to everything?
What we did discuss, okay, through the chair, that we did not want to strip the town. We wanted to keep one ambulance in town.
Sure.
And that, just to make sure that our mutual aid partners are aware of that. You know, we've had situations recently where, you know, all three ambulances went mutual aid.
Yeah.
And it's tough. So we've talked about it and we felt that we need to keep one ambulance in town.
Yeah,
And I think it's
that
only
makes
fair,
sense.
you know.
Oh, yeah. And that should, and again, if that's in that mutual agreement to that town, so that they're aware, if they're calling for ambulance, we may not be able to provide it because we need to keep one available for us.
Like some kind of clause.
Yeah.
I think they used to have that years ago, some kind of clause that said we have to make sure that there's ample here prior to being able to share beyond that.
But what we did want to emphasize also, is that, you know, I always joke about it, if the 5-story wood frame foundling hospital was on fire with 300 babies in a window,
Yeah.
we're all going.
Right.
Well,
So,
we
you know,
leave that to you.
So,
That's why
but
that clause.
normally, it's getting crazy.
Right. And like I said, OEMS, they recognize mutual aid as that instance of it's a natural disaster.
Right.
It's a large scale incident, and providing that's their template for a mutual aid agreement for EMS agencies is for those large scale events. It doesn't, because you're not supposed to cover your day-to-day calls with mutual aid ambulances per OEMS, right? It's not, they want you to provide all the ambulances you need, which nobody can do. Nobody can, whether you're a city or a small town. So I think we just have to create them for our use. And at least they're written in, you know, they're official.
I think it's a lot easier to work on that, make it work in a smaller venue like Bethel than it is down the street here, which is a constant subject of discussion at the governmental level. And they're very aware of that. Don. Not making all their calls every day is a challenge.
Yeah.
You know, so.
Okay. I'll get those agreements back from Melanie to see where she stood on, because she was working on a standard agreement to help the department. That just wouldn't, would pass the muster of HIPAA, because the first one was very cookie cutter. It was basically something they gave us and everybody just signed.
Yeah,
it.
that was the one for Newtown, right?
Yeah, it was pretty scary looking. Okay. Is there any further information or any items that should come before the commission?
I don't know.
Okay.
Laura? Mary? With that, then we'll accept a motion to adjourn.
So moved.
Do I have a second?
Second.
All in favor, say aye.
Aye.
We stand adjourned. It's 5:29 PM. Thank you, everybody.
Well, thank you.
Thanks for coming, guys.
Yes, thanks for.
I know it wasn't exciting, but it's only a quarter.